5 hidden signs an elderly person is preparing for their final goodbye. Most people think that death in old age comes suddenly, like a switch being flipped. But in reality, the body often whispers before it stops. Quiet signs, subtle shifts, signals that life may be entering its final chapter. The heartbreaking part? These warnings are easy to miss. They seem like nothing at first, just signs of aging we tell ourselves. But looking back, many families realize the truth far too late, and by then, it's already time to say goodbye. In this video, we'll uncover 5 powerful signs that often appear up to a year before an elderly person passes away. Some of these may already be happening right in front of you, but you've brushed them off, not knowing what they truly meant. Recognizing these signs early can make all the difference. It gives you a chance to provide better care, share meaningful conversations, and most importantly, ensure your loved one's final moments are filled with comfort, dignity, and peace. So stay with us until the end, because what you learn today could help you prepare emotionally and practically for the road ahead. Let's start. Sign number 1. Sudden, unintentional weight loss. One of the earliest and most overlooked signs that someone may be in their final year of life is unexpected weight loss. At first, it's barely noticeable, a belt that suddenly feels loose, a favorite sweater that hangs a little differently, or a dinner plate that always comes back half full. Most families chalk it up to just old age. But the truth is, losing weight without trying is never normal, and rarely harmless. As we age, some muscle loss is expected, but when weight loss happens quickly and without explanation, it's often the body's way of saying something deeper is happening. Here's what could be going on behind the scenes. The body may no longer be absorbing nutrients efficiently. Even if they're eating the same amount, their system can't process food the way it used to. Muscle mass begins to break down, leading to weakness, fatigue, and a higher risk of falls or infections. The appetite fades. Food loses its flavor. Hunger signals become weaker. Meals are skipped, not out of choice, but because the brain no longer receives the message to eat. In fact, this appetite loss isn't just about taste or preference, it's a physiological sign. When the body begins to shut down, it naturally reduces its need for energy. That's why your loved one may seem disinterested in meals they once loved. But there's more. Weight loss can also be a symptom of serious underlying conditions, like cancer, heart failure, kidney disease, or even advanced depression and cognitive decline. These issues may already be progressing quietly before more dramatic symptoms emerge. In many cases, families try to help by offering favorite foods, high-calorie snacks, or protein shakes. And while these efforts come from a place of love, they often aren't enough. Because it's not just about the food anymore. It's about the body's changing ability to sustain itself. So if you've noticed your loved one shrinking before your eyes, don't ignore it. It might be more than just aging. It could be the body's way of preparing for its final goodbye. But if the weight continues to drop despite your best efforts, if favorite meals, snacks, and supplements no longer make a difference, it's time to recognize the deeper truth. This isn't just about diet anymore. It's the body preparing for a profound transition. At this stage, forcing large meals may do more harm than good. What matters more is comfort. Offering small, easy-to-eat meals, keeping them hydrated, and ensuring they feel cared for. If your loved one is eating less, feeling weaker, or struggling to stay active, don't ignore it. This isn't just a cosmetic issue. It's a signal from the body. And recognizing it now can help you prepare, respond with compassion, and make every remaining moment count. Sign number 2. extreme fatigue and weakness. One of the most noticeable shifts in the final year of life is a deep, persistent fatigue, the kind that doesn't go away with sleep. This isn't just feeling tired. It's a profound exhaustion that makes everyday tasks feel almost impossible. Getting out of bed becomes a chore. Walking across the room feels like running a marathon. Even simple things, like dressing, cooking, or chatting with loved ones, start to feel too draining. This type of fatigue isn't just from aging. It's a sign that the body is slowing down to conserve energy. As organ function begins to decline, the body redirects its energy to support only the most vital systems. The heart pumps less efficiently, blood circulation weakens, and muscles stop getting the oxygen they need, leading to weakness, dizziness, and increased risk of falls. Another reason behind this fatigue is metabolic slowdown. The body, sensing its final phase, shifts from energy production to energy preservation. This is why your loved one may start sleeping more, napping frequently, and feeling unable to stay awake for long periods. Some may experience sudden energy crashes, fine one moment, completely drain the next. But perhaps the hardest part to witness is the emotional impact. People who once prided themselves on their independence may feel frustrated, embarrassed, or even ashamed. They might pull away from conversations, stop going out, abandon hobbies, not because they don't care, but because they just don't have the strength. This can lead to a painful cycle of withdrawal and isolation, which often speeds up the decline. For families, watching a loved one fade from energetic and engaged to quiet and tired is incredibly difficult. It's easy to misread this as laziness or depression. But the truth is, forcing activity won't help. What matters most now is acceptance. Let them rest when they need to. Remove pressure. Focus on their comfort. And above all, help them feel safe, loved, and understood. If someone you love is experiencing this kind of deep, unrelenting fatigue, it's a sign of a deeper shift. Now is the time to slow down with them, share calm moments, and make peace with what lies ahead. Sign number 3. Increase cognitive confusion or withdrawal. As someone approaches the final stage of life, changes in how they think, communicate, and connect with others can become more noticeable and more concerning. You might start to notice that a once sharp and alert loved one now struggles to follow conversations, forgets names or dates, repeats themselves, or seems disoriented even in familiar surroundings. These changes can happen gradually, over several months or even a full year before death. And while occasional forgetfulness is normal with age, this is different. This isn't just senior moments. It's the brain responding to changes in the body. Like every other organ, the brain needs oxygen and nutrients to function. But as circulation decreases, the brain begins to slow down. And when it does, signs of cognitive decline begin to appear, even in people who never had memory issues before. As the oxygen supply to the brain diminishes, cognitive function begins to decline. Your loved one may become increasingly confused, struggle to make decisions, or have difficulty recognizing familiar faces and places they've known for years. Sometimes, they may have brief moments of clarity, only to be followed by sudden bouts of confusion, almost as if their mind is flickering in and out. Another common sign is emotional withdrawal. People nearing the end of life often lose interest in socializing. You might notice them speaking less, engaging less, or spending long periods sitting quietly in silence. It's not that they don't care about those around them. Rather, their brain no longer processes emotions and social interactions the same way. Conversations can become exhausting. Loud or busy environments may feel overwhelming, leading many seniors to slowly retreat into their own world. You may also observe mood and behavior changes. Some become more irritable, anxious, or easily frustrated, while others may appear unusually calm, detached, or indifferent to things they once cared deeply about. This isn't simply a personality change. It's often the brain adapting to the body's overall decline. As cognitive functions slow, expressing emotions becomes harder and responses to everyday situations can shift. For families, this stage can be especially heart-wrenching. Watching a loved one lose touch with reality or emotionally pull away can feel like losing them before they're actually gone. But it's crucial to remember that these changes are beyond their control. Instead of trying to force them back into conversations, meet them where they are. Speak softly, offer gentle reassurance, and know that even when they don't respond, they can still feel your presence. If you notice your loved one becoming more forgetful, confused, or withdrawn, don't ignore it. These are often early signs that both mind and body are preparing for the final transition. This is the time for patience, to cherish quiet moments, and to create a calm, familiar, and peaceful environment. Because even when words fade, love and comfort remain. Moving on to number 4, frequent infections and slow healing. As the body begins to shut down, one of the clearest physical signs is a weakening immune system. You might notice that someone who rarely got sick before now seems to catch every cold, flu, or minor infection that comes their way. Illnesses that used to pass quickly now linger for weeks, and even small cuts or bruises take much longer to heal. These aren't random occurrences, they are signs that the body's ability to defend and repair itself is diminishing. Recurrent infections like pneumonia, urinary tract infections, skin infections, or oral infections become far more common. Families may see these as isolated incidents, but when infections become frequent or stubbornly persistent, it often indicates the body is losing its ability to fight back. Even antibiotics that once worked swiftly might seem less effective, requiring stronger medications, longer courses of treatment, or multiple rounds. This happens because, as circulation slows and organ function deteriorates, the body's response to treatment weakens. Another frequently overlooked issue is chronic wounds. If small scratches, sores, or bruises fail to heal or repeatedly reopen, it's likely due to compromised blood flow. Poor circulation means oxygen and nutrients aren't reaching the skin and tissues efficiently, dramatically slowing healing. Pressure sores, especially in less mobile individuals, become a serious risk and can lead to dangerous infections if not carefully managed. What's more concerning is that infections in the final year of life often don't present as we might expect. Instead of a high fever, your loved one may simply seem more tired, more confused, or lose interest in eating. In fact, sudden declines in mental alertness are often the very first warning signs of infection, sometimes even before more obvious symptoms appear. That's why recognizing these subtle changes early can make a huge difference in how much comfort and care your loved one receives during this critical time. Supporting an elderly loved one during their final stage of life can be incredibly challenging and emotional, especially when they experience repeated infections. It's natural to want to pursue aggressive treatments, hoping that another course of antibiotics or hospital visit will improve their condition. However, at some point, the focus often shifts from trying to cure to providing comfort. Ensuring they stay hydrated, keeping their skin clean and moisturized, and reducing physical stress can do more to improve their quality of life than additional medications that may only extend suffering. If you're finding this video helpful, please comment with the number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend subscribing and turning on the notification bell so you don't miss future videos. Your support helps us keep creating valuable content to inform and inspire you. Now, let's move on. Number 5. Significant changes in breathing and circulation. One of the most noticeable signs that the body is entering its final stage is a change in breathing and circulation. You may observe your loved one breathing more slowly or shallowly than usual. Sometimes, there may be pauses between breaths or irregular breathing patterns, alternating between fast and slow breaths. This is sometimes known as Cheney-Stokes respiration, where breathing cycles between deep, rapid breaths and long pauses. These changes often start subtly but become more frequent and pronounced over time. You might also notice weakened circulation. Hands, feet, nose, or ears may feel cold, and the skin may look pale, bluish, or mottled, especially on fingers and toes. This happens because the body prioritizes blood flow to vital organs, reducing circulation to the extremities, a sign the heart isn't pumping as strongly as before. Shortness of breath can also increase, even with minimal movement like sitting up, talking, or shifting position. Your loved one might start breathing through their mouth more often or need to pause frequently to catch their breath. If they previously walked easily but now struggle to do so, lung function might be declining. Fluid buildup in the lungs can cause coughing, gurgling sounds, or chest tightness. While some may assume it's just congestion, in elderly individuals nearing the end of life, these symptoms often indicate weakening lungs. They might prefer to sleep propped up on pillows or in a recliner to ease breathing. For family members, witnessing these changes can be alarming. It's normal to want to help, encourage deeper breaths, or worry something urgent is happening. However, these changes often reflect the body naturally slowing down. While reversing these signs isn't always possible, there are ways to improve comfort. Keeping the room cool, using a humidifier, and offering small sips of water can help ease breathing difficulties. Sometimes, oxygen therapy or medication can provide relief, but the goal shifts toward comfort rather than cure. If you notice changes in breathing, cold extremities, or bluish skin, pay close attention. These signs often show the body conserving energy and circulation slowing down. It's a time to be present, offer reassurance, and create a peaceful environment where your loved one feels safe and at ease. In these final months or weeks, what matters most isn't aggressive medical intervention. It's providing comfort, dignity, and letting them know they are not alone. Final thoughts. As we wrap up, reflect on the 5 signs we've covered: significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation. These signs often appear in the year leading up to an elderly person's passing. They may not all occur simultaneously or be immediately obvious, but noticing them can signal the body is preparing for its final transition. For many families, accepting these changes is difficult. It's natural to want to push your loved one to eat more, stay active, or fight through exhaustion. But sometimes the best approach is to listen to what their body is telling you. Instead of trying to reverse the inevitable, focus on making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs is not about fearing death, it's about being prepared. Early recognition allows you to provide better care, make important decisions ahead of time, and ensure your loved one's final months are filled with love and dignity. This is a time for cherishing moments, sharing stories, and reminding them they are valued and never alone. If you see these signs in someone close to you, take a deep breath and remember you are not alone. Many families have faced this journey, and while it is never easy, understanding what to expect can help you find strength, patience, and peace. Thank you for joining us today. We'd love to hear from you. Please leave a comment below sharing one thing you learned and how you plan to use it. Your thoughts inspire and motivate us. If you found this video helpful, please like, subscribe, and share. Your support allows us to continue creating meaningful content to inform and inspire. Thanks for watching. We look forward to seeing you in the next video.